heard this REACH e-health study. You know that hypertension is the most important risk factor in cardiovascular disease, and it's well known that you can lower blood pressure by just lifestyle modification to a certain degree, about 4 millimeters of mercury in systolic blood pressure. But this trial asked the question whether you use e-health and cognitive counseling, could you, by lifestyle modification and e-health, lower blood pressure even more? And they did that in 194 patients that they got out of 7,000 blood pressure patients. And they were randomized to either have advice on how blood pressure should be, that is just internet information, or active counseling on cognitive behavior that would reduce blood pressure at regular intervals over 1 full year. And what they could show is that they could double this lifestyle modification decrease in systolic blood pressure from 4, as known previously, to 10 millimeter mercury, so double the effect. And that the effect was even greater, seemed to be in women as concerned blood pressure in lowering. They could also show that pulse pressure, which is important, was lowered by 5 millimeter mercury, very good indeed.
What were the e-health interventions?
Well, they didn't go much into that. They said cognitive counseling. I suspect that was to reinforce them doing regular exercise, controlling their diet by doing more fruit and vegetable helpings per day.
Were you surprised by the results?
Well, first of all, it seems to be a rather select group of patients. No, I'm not quite surprised by it. You know, if you really focus on motivated patients, listening to advice, doing it as they're told as compared to not doing it, yes, I'm not surprised. But the important thing is that if you can lower blood pressure as much as they did, 10 millimeter mercury, you can also reduce risk for cardiovascular disease by 20%, reduce stroke risk by 27%, and total mortality by 10%. So it's quite a significant achievement without using any additional drugs, just lifestyle.